Coronavirus disease, COVID-19, is an infectious respiratory disease caused by a newly discovered coronavirus. Till now it has spread to 199 countries, causing 56,000 deaths. We are here discussing statistical data and some important news of this spread. Coronaviruses are named for the crown-like spikes on their surface. There are four main subgroupings of coronaviruses, known as alpha, beta, gamma, and delta. People around the world commonly get infected with human coronaviruses 229E, NL63, OC43, and HKU1. Sometimes coronaviruses that infect animals can evolve and make people sick and become a new human coronavirus. Recent examples of this are SARS-CoV and MERS-CoV, including 2019 nCoV. These are categorized under beta coronavirus. SARS-CoV-2 is the novel beta virus causing COVID-19 coronavirus disease. As the paper, written by a large group of Chinese researchers from several institutions, the patient became ill on December 1, 2019 and had no reported link to the seafood market, the authors report. No epidemiological link was found between the first patient and later cases, they state. Their data also show that, in total, 13 of the 41 cases had no link to the marketplace. That's a big number, 13, with no link, says Daniel Lucy, an infectious disease specialist at Georgetown University. Earlier reports from Chinese health authorities and the World Health Organization had said the first patient had onset of symptoms on December 8, 2019. If the new data are accurate, the first human infections must have occurred in November 2019, if not earlier, because there is an incubation time between infection and symptoms surfacing. If so, the virus possibly spread silently between people in Wuhan, and perhaps elsewhere, before the cluster of cases from the city's now infamous Huanan seafood wholesale market was discovered in late December. The virus came into the marketplace before it came out of that marketplace. It was on December 10 that Wei Gixian, a seafood merchant in the city's Huanan market, first started to feel sick. Thinking she was getting a cold, she walked to a small local clinic to get some treatment and then went back to work. 8 days later, the 57-year-old was barely conscious in a hospital bed, one of the first suspected cases in a coronavirus. This patient is believed to be patient 0 as on March 29. On the morning of December 26, 2019, a pair of old couples in the neighborhood of the Hubei Provincial Hospital of Integrated Traditional Chinese and Western Medicine where Zhang Jixian worked, came to see the doctor for fever and cough. At that time, the couple to the hospital by themselves, and the CT scan of the chest showed completely different from other viral pneumonia. Zhang Jixian asked the old couple to call their son for an examination. The son had no symptoms, but when the CT was taken, the lungs were the same as the old couple. On the same day, a merchant from the South China seafood market also had the same fever, cough, and same lung performance. Generally speaking, there will only be one patient when a family visits a doctor, and not 3 of them will get the same disease at the same time, unless it is an infectious disease. Zhang Jixian did these patients with influenza A, influenza B, syncytial virus, adenovirus, rhinovirus, chlamydia, mycoplasma and other influenza-related tests. All patients were negative, thereby eliminating the flu. The flu was ruled out, but Zhang Jixian's doubts became stronger and stronger. On December 27, 2019, she reported the situation of the 4 individuals to Xia Wang, the deputy dean, the hospital's sensing office and the medical department. The hospital immediately reported it to Jiangnan District CDC. The outpatient clinic successively treated 3 patients who also came from the South China seafood market, and now there are 7 similar patients. This is a disease we have never seen before. There are also 4 patients from the South China seafood market. This is definitely a problem. Zhang Jixian judged. In 7 patients, the symptoms were consistent with those of the lungs, with only differences in severity. Zhang Jixian keenly realized that the situation was wrong, and immediately reported to the hospital, and suggested that the hospital hold a multi-department consultation. On December 29, 2019, Sunday, the CDCs of the provincial and municipal health committees responded quickly after receiving the report, instructing Wuhan CDC, Jinyangdan Hospital, and Jiangnan District CDC to come to the hospital and begin an epidemiological investigation. In the evening of the same day, experts from Wuhan Infectious Diseases Hospital, Jinyangdan Hospital of Wuhan City came to Hubei Provincial Hospital of Integrated Traditional Chinese and Western Medicine to inspect these 7 patients one by one, and picked up 6 patients, including 3 with mild disease and 3 with severe disease. Only the son of the family of 3 resolutely refused to go to Jinyangdan Hospital and stayed at Zhang Jixian to continue treatment. On December 30th, Dr. Li sent a message to his medical school alumni WeChat group, warning that the ophthalmology department in his hospital had put 7 patients from a local seafood market into isolation wards after they were diagnosed with severe acute respiratory syndrome, SARS. On analysis of the samples, the amino acid sequence of the tentative receptor binding domain resembles that of SARS-CoV. The virus is phylogenetically closest to a bat SARS-like CoV. Official notice on the treatment of pneumonia of unknown cause was issued by the Wuhan Municipal Health Committee. On December 31, 2019, the WHO China Country Office was informed of cases of pneumonia unknown etiology, unknown cause, detected in Wuhan City, Hubei Province of China. According to an announcement from the Health Commission of Hubei Province, it had commenced investigation and so far identified 27 cases. Among them, 7 cases were serious and the remaining were stable. Symptoms were mainly fever while a few had presented with shortness of breath. All patients are isolated and receiving treatment. Contact tracing of close contacts and medical surveillance are ongoing. The Wuhan Municipal Health Commission announced the time being, no obvious human-to-human transmission has been observed and no healthcare workers have been infected. Many news was circulating on the social media on the outbreak. The Wuhan Municipal Public Security Bureau reported on the 1st that some false information about Wuhan viral pneumonia was circulating on the internet. Wuhan police reminded that laws and regulations should be followed when posting information and remarks on the internet. Wuhan South China Seafood Market has been closed for sanitation. On 2nd of January, 41 admitted hospital patients in Wuhan, China, were confirmed to have contracted, laboratory confirmed, the 2019 nCoV, novel coronavirus. On January 3, 2020, Chinese scientists determined the genetic sequence of the novel beta genus coronaviruses, naming it 2019 nCoV. On January 3, 2020, Li Wenliang was summoned to the Wuhan Public Security Bureau to sign an official confession and admonition letter promising to cease spreading false rumors regarding the coronavirus. The mysterious and growing cluster of unexplained pneumonia cases in the Chinese city of Wuhan has infectious disease experts parsing limited public statements from Chinese authorities for clues to what is happening. With machine-translated reports that the outbreak might be caused by a new virus, and perhaps even a new coronavirus, the family of viruses that produced both SARS and MERS, watchers were hoping that Chinese authorities will provide additional information soon. Chinese scientists ruled out severe acute respiratory syndrome, SARS, bird flu and Middle East respiratory syndrome, influenza and adenovirus. The New York Times reported that rumors of a potential SARS outbreak gained traction online earlier this month, but Chinese authorities have since censored the hashtag Wuhan SARS and are now investigating 8 people in Wuhan who allegedly spread misleading information about the outbreak on social media. There are allegations that the Chinese government failed to adequately inform the public and international health agencies during the historic SARS epidemic, which may explain the reaction of Chinese citizens to this new illness. Chinese scientists investigating a mystery illness that has sickened dozens in central China have discovered a new strain of coronavirus, a development that will test the country's upgraded capabilities for dealing with unfamiliar infectious diseases. The Chinese government agrees to accept a WHO scientific team to assist their own researchers. South Korea and Thailand reports their first suspected cases of coronavirus. The WHO confirmed that the novel coronavirus had been isolated from one person who had been hospitalized. The WHO also reported that Chinese authorities had acted swiftly. The first death from the virus occurred in a 61-year-old man who was a regular customer at the market. He had several significant medical conditions, including chronic liver disease, and died from heart failure and pneumonia. Chinese scientists submitted the gene sequencing data for posting on virological.org, a hub for pre-publication data designed to assist with public health activities and research. Earlier this week, they announced that they had isolated and fully sequenced the virus, setting off calls for full release of the details. On January 10, 2020, Li Wenliang, Chinese ophthalmologist and coronavirus whistleblower, started having symptoms of a dry cough. On January 12, 2020, Wenliang started having a fever. He was admitted to the hospital on January 14, 2020. His parents also contracted the coronavirus, presumably from Wenliang, and were admitted to the hospital with him. Wenliang tested negative several times for the coronavirus until finally testing positive on January 30, 2020. China announced its first death from the virus, a 61-year-old man who had purchased goods from the seafood market. Treatment did not improve his symptoms after he was admitted to hospital and he died of heart failure on the evening of January 9. The first two patients in Shenzhen City transferred into negative pressure room in Third People's Hospital of Shenzhen City due to matching lab test result, symptoms, and epidemiology and are being listed as suspected cases. The cases were not confirmed at the time, because requirement from the Chinese government at the time was that first case in each individual cities need to be submitted to provincial CDC, verified by national CDC, and then evaluated and confirmed by a specific diagnostic team in national CDC. On 12 January, Li was admitted to intensive care at Hu Hospital District, Wuhan Central Hospital, where he was quarantined. On January 13, 2020, Thailand reported the first imported case of lab-confirmed novel coronavirus, 2019 nCoV, from Wuhan, Hubei Province, China. The case is a 61-year-old Chinese woman living in Wuhan City, Hubei Province, China. On January 5, 2020, she developed fever with chills, sore throat and headache. On January 8, 2020, she took a direct flight to Thailand from Wuhan City together with 5 family members in a tour group of 16 people. The traveler with febrile illness was detected on the same day by thermal surveillance at Suvarnabhumi Airport, BKK, Thailand, and was hospitalized the same day. A Wuhan health official said there may be a family cluster among the outbreak patients, pointing to the possibility of human-to-human spread. Wuhan's Health Commission today reported one more death, raising the fatality count and the outbreak to 2, according to a statement translated and posted by Flu Trackers. The patient, who died yesterday, is a 69-year-old man who got sick on December 31 and whose illness worsened on Jan 4. On 19 January, the first confirmed cases were reported in China, outside Wuhan, 1 in the southern province of Guangdong and 2 in Beijing. Wuhan reported 136 additional laboratory-confirmed cases, bringing the total number of laboratory-confirmed cases in China to 201. A new death was also reported in Wuhan, bringing the total number of fatalities in China to 3. On 20 January, after 2 medical staff were infected in Guangdong, China announced that the virus was human-to-human transmissible. Scientists from the China CDC identified 3 different strains of the 2019 nCoV, confirming that the original Wuhan coronavirus had mutated into 2 additional strains. WHO has said it is deeply concerning and could signal evidence of a much larger outbreak. China's top leaders have warned lower-level officials not to cover up the spread of a new coronavirus that has now infected nearly 300 people. The United States has its first confirmed case of a new virus that appeared in Wuhan, China, last month, the U.S. Centers for Disease Control and Prevention announced Tuesday. The coronavirus has already sickened hundreds and killed 6 people in Asia. Public transportation such as bus, subway, ferry and long-distance bus in Wuhan will be temporarily closed since 10 a.m. Thursday. All flights and trains departed from Wuhan will be temporarily cancelled to reduce risk of spread of the new virus. A terrifying graph shows how fast the Wuhan virus has spread so far and how close it is to becoming a pandemic. Wuhan went on to lockdown. The cases started reporting from many countries. Chinese Communist Party General Secretary Xi Jinping called the accelerating spread of the coronavirus a grave situation in a party Politburo meeting. A Level 1 health emergency was declared in the 10 provinces and 3 autonomous regions of China. The Chinese Center for Disease Control and Prevention, CCDC, has started developing vaccines against the coronavirus. The first of 5 patients was already discharged. China started requiring nationwide use of monitoring stations for screening, identification and immediate isolation of coronavirus-infected travelers. Gabriel Leung, Dean of the University of Hong Kong Medical School and one of the foremost world experts on SARS and viruses, projected the true number of coronavirus infections was likely 10 times more than the official reported numbers. He stated that draconian measures were needed to slow the progress of the virus but that these measures would have no effect in stopping the coronavirus pandemic. He projected that the number of infections would continue exponentially peaking out in late April or May 2020. Leung predicted that at the peak of the pandemic, there could be up to 100,000 new infections per day. China's Supreme People's Court ruled that whistleblower, Li Wenliang, had not committed the crime of spreading rumors when on December 30, 2019 he posted to a WeChat forum for medical school alumni that 7 patients under his care appeared to have contracted SARS. In their ruling, the Supreme People's Court stated, if society had at the time believed those rumors, and wore masks, used disinfectant and avoided going to the wildlife market as if there were a SARS outbreak, perhaps it would have meant we could better control the coronavirus today, the court said. Rumors end when there is openness. A patient in Kerala's Thrissur district has tested positive for novel coronavirus and has been kept in isolation at a hospital. The patient, a student of Wuhan University, is stable and is being closely monitored. The WHO Director General declares the coronavirus outbreak a public health emergency of international concern, FIC, reversing 2 previous decisions after emergency committee meetings in the last week. The new coronavirus has been declared a global emergency by the World Health Organization, as the outbreak continues to spread outside China. The main reason for this declaration is not what is happening in China but what is happening in other countries, said WHO Chief Tedros Adhanom Ghebreyesus. Travel bans and export bans for medical supplies imposed by many nations. In Philippines, the 44-year-old male, who had travel history to Wuhan, passed away due to coronavirus. This is the first death reported outside China. The man was found to have severe pneumonia, a lung inflammation due to viral or bacterial infection. The number of deaths in Hubei outside Wuhan reached 101. India confirmed its 3rd case in Kerala. The Centers for Disease Control and Prevention plan to distribute testing kits to speed up the diagnosis of the coronavirus. WHO reiterated that no known effective treatment is available for the coronavirus. Chinese experts said that nucleic acid testing was only able to identify 30% to 50% positive cases. Japan confirmed 10 new cases from the quarantined cruise ship Diamond Princess, near Yokohama. United Airlines and American Airlines suspended U.S. flights to and from Hong Kong. Americans were evacuated from Wuhan to the United States. Hong Kong announced mandatory 2-week quarantine for all visitors from mainland China or Macau. The Bill and Melinda Gates Foundation committed over $100 million for better detection, isolation, and treatment research for the virus. Coronavirus, whistleblower Dr. Li Wenliang confirmed dead of the disease at 34, after hours of chaotic messaging from hospital. The World Health Organization posted on Twitter saying that it was deeply saddened by the passing of Dr. Li Wenliang and we all need to celebrate work that he did on 2019 nCoV. The White House asked scientists in the U.S. to investigate the origins of the virus. The U.S. announced aid of up to $100 million for China and other nations. The coronavirus death toll in China has risen to 811, surpassing the death toll from the SARS epidemic of 2002-03, according to official data released early Sunday. The SARS epidemic, which also began in China, killed 774 people worldwide. Many doctors believe that deaths and infections from the current epidemic in China are undercounted because testing facilities at hospitals and laboratories are under severe strain. The World Health Organization says the official name for the disease caused by the new coronavirus is COVID-19. The virus itself has been designated SARS-CoV-2 by the International Committee on Taxonomy of Viruses. Fox Business anchor Maria Bartiromo talked to a top Trump advisor about the possibility that the coronavirus was a biological weapon developed by China. During a conversation about the virus's effects on trade and economy, Bartiromo asked White House trade advisor Peter Navarro on Monday about the idea that the Chinese government may have manufactured the deadly virus in a weapons lab to target the United States. The WHO chief said the first vaccine targeting the coronavirus could be available in 18 months, so we have to do everything today using available weapons. The United States CDC manufactured kits, and on February 6 and 7, 90 test kits were shipped to the public health labs. Some labs began to have trouble with the test. On February 12, the CDC announced the test was providing inconclusive results in some laboratories. The problem was in one of the 3 components of the test. Egypt has confirmed its first case of a deadly coronavirus in Africa. Health Ministry spokesman Khaled Magal said in a statement on Friday that the affected person was a foreigner who did not show any serious symptoms. Officials were able to confirm the case through a follow-up program implemented by the government for travelers arriving from countries where the virus has spread. The ministry statement said the person was hospitalized and in isolation. It did not specify the person's nationality or their point of entry. A Chinese tourist has died in France after contracting the new coronavirus, the first fatality from the disease outside Asia. The victim was an 80-year-old man from China's Hubei province. He arrived in France on 16th of January and was placed in quarantine in hospital in Paris on 25th of January. From February 18, China reported less number of cases diagnosed with corona than February 17. This hints flattening of curve process. A flatter curve indicates the same number of people ultimately get infected and the disease is under control from spreading more. The countries can follow different curves. First one is steep curve, for this do nothing, but more people will die. The curve takes on different shapes, depending on the virus's infection rate. It could be a steep curve, in which the virus spreads exponentially and the total number of cases skyrockets to its peak within a few weeks. Infection curves with a steep rise also have a steep fall after the virus infects pretty much everyone. Second is a flatter curve, in which the same number of people ultimately get infected, but over a longer period of time. A slower infection rate means a less stressed healthcare system, fewer hospital visits on any given day and fewer sick people being turned away. Less causalities. The third is a better flatter curve, almost reducing the number of infected. This requires complete lockdown at earlier stage and social distancing strictly implemented. Italy reports first deaths. An elderly Italian man became the first European national to succumb to COVID-19 on Friday. He died in a hospital in the northern city of Padua, Italian Health Minister Roberto Speranza said, adding that the 78-year-old had been in the hospital for 10 days for an unrelated illness. A second person, a woman in the northern region of Lombardy, also died from coronavirus, Italian news agency ANSA said on Saturday. The U.S. reported on Saturday its first death from the coronavirus in King County in Washington state. The patient was a man in his 50s with underlying health conditions, who was tested at the Washington State Public Health Lab, according to U.S. health officials. There was no evidence that he got the infection through travel. The death comes as several cases in Washington state, California and Oregon have raised fears over the local, person-to-person transmission of the virus in people who have not recently traveled or been in contact with infected people. NASA releases new satellite images over China that show air pollution has decreased a large amount due to reduced travel and industrial facilities being closed. The image shows decline in nitrogen dioxide in China partly due to the outbreak. The Chinese city at the center of the coronavirus epidemic has closed the first of 16 specially built hospitals, hurriedly put up to treat people with the virus, after it discharged its last recovered patients, state broadcaster CCTV said on Monday. News of the closure coincided with a sharp fall in new cases in Hubei province and its capital of Wuhan, but China remained on alert for people returning home with the virus from other countries where it has spread. Mi Feng, a spokesman for China's National Health Commission, told the rapid rising trend of virus cases in Wuhan has been controlled. Iran has temporarily released more than 54,000 prisoners in an effort to combat the spread of the new coronavirus disease in crowded jails. The inmates were allowed out of prison after testing negative for COVID-19 and posting bail. Security prisoners sentenced to more than 5 years will not be let out. The World Health Organization, WHO, Director General has stated that the latest global death rate of the new coronavirus outbreak is far higher than seasonal flu, 3.4%.
The World Health Organization has formally declared the COVID-19 outbreak a pandemic. WHO is deeply concerned both by the alarming levels of spread and severity. The WHO chief noted that this is the first time a coronavirus has been seen as a pandemic.
Panic over the coronavirus on global financial markets amid the biggest market crash in a generation has forced the U.S. central bank to inject trillions of dollars into bond markets in a dramatic attempt to prevent a repeat of the 2008 credit crunch. As stock prices plunged around the world on Thursday, with both the London and New York markets suffering their worst day since the Black Monday crash of October 1987, the New York Federal Reserve said it would pump $1.5 trillion into the American financial system to stop markets from freezing up. A 76-year-old man who died has become India's first COVID-19. The man who recently returned from Saudi Arabia, had died on Tuesday night. Officials said the patient had severe comorbidities such as history of hypertension, diabetes and asthma and appendicitis. U.S. President Donald Trump on Friday declared a national emergency over the fast-spreading coronavirus to free up $50 billion in federal aid and said he would most likely be tested for the virus himself soon after facing possible exposure. Trump made the announcement at a Rose Garden news conference as he battled to show Americans he is aggressively addressing the health crisis after facing criticism that he was slow to react and played down the threat until the number of cases rose. As a part of initiative led by Indian Prime Minister Narendra Modi, India pledged $10 million toward a COVID-19 emergency fund and said it was putting together a rapid response team of doctors and specialists for South Asian Association for Regional Cooperation, SARC, nations. South Korea has emerged as a sign of hope and a model to emulate. The country of 50 million appears to have greatly slowed its epidemic. It reported only 74 new cases today, down from 909 at its peak on 29th of February. And it has done so without locking down entire cities or taking some of the other authoritarian measures that helped China bring its epidemic under control. Behind its success so far has been the most expansive and well-organized testing program in the world, combined with extensive efforts to isolate infected people and trace and quarantine their contacts. South Korea has tested more than 270,000 people, which amounts to more than 5,200 tests per million inhabitants, more than any other country except tiny Bahrain. Interestingly, as per US CDC data, the United States has so far carried out 74 tests per 1 million inhabitants. Australian Prime Minister Scott Morrison on Wednesday declared a human biosecurity emergency. He said the citizens should abandon all overseas travel because of the coronavirus epidemic for at least 6 months. Testing, testing, testing. The novel coronavirus has revealed the critical importance of swift and accurate testing and reporting. Slowing its spread hinges on finding those who test positive for the virus and ensuring they're quarantined immediately. This requires a coordinated effort to identify all who could have come into contact with infected individuals, and testing as many of them possible, as quickly as possible. Widespread testing enables the detection of virus carriers without symptoms who could infect others. And only testing can uncover the full scope of the problem. The data shows how more number of tests helps the country to contain the virus spread. Italy has surpassed China as the country with the highest death toll, becoming the epicenter of a shifting pandemic. Italy's experience shows that steps to isolate the coronavirus and limit people's movement need to be put in place early and shall be strictly enforced. Wuhan, the center of the coronavirus outbreak in China, has begun to loosen its 2-month lockdown on citizens as more countries issued new restrictions to contain the pandemic. Small groups of residents in the central Chinese city were leaving their residential compounds, going to grocery stores and walking along the streets for the first time in weeks. Local authorities said residents could begin returning to work if they did not have a temperature and could provide a green health code. America has been testing people for the coronavirus at a slower rate than most other developed countries, yet the number of people diagnosed with COVID-19 in the U.S. has still been rising steadily. The U.S. health system was less prepared for a pandemic than those of other wealthy nations. America's lax response in the early days of the outbreak only compounded those problems. The graphical representation shows, the number of confirmed cases in the United States increased exponentially and crosses 80,000 mark within 20 days, surpassing all other countries. As on March 29, the number of confirmed cases and number of death rates are increasing exponentially in the world. There are no indication of containment as per the data. Analyzing the data of corona spread in India, India has managed to start widening and flattening the curve with the lockdown. The death number are increasing, but the numbers are low compared to others. According to the Johns Hopkins Coronavirus Resource Center, the number of confirmed cases in the United States grew at a faster rate than any other country in the world yesterday. It is no secret that coronavirus testing in the United States has lagged compared to other countries. Limited testing in the United States potentially downplays the numbers below, leaving the true number of cases unknown. Though the rest of the world appears to be struggling to contain the coronavirus, China has brought down its daily new cases dramatically, from more than 1,000 just a few weeks ago. Italy now has the highest number of deaths from COVID-19 in the world as on 29th of March. The country's fatality rate from COVID-19, at 10%, is much higher than the global average of 3.4%, according to the World Health Organization. The United States now has the highest number of known cases of coronavirus in the world as on March 29. United States cases grew by 5,894, equaling a growth of 76%. The data shows, the spread in China is contained and spread outside China is exponentially growing. The data shows, how the number of per-day cases surpasses the Italy after 20th of March. On March 25, the number of cases per day is 3 times in USA than in Italy. The overall goal of the Strategic Preparedness and Response Plan is to stop further transmission of 2019 nCoV within China and to other countries, and to mitigate the impact of the outbreak in all countries. The strategic objectives of the plan are to limit human-to-human transmission, including reducing secondary infections among close contacts and healthcare workers, preventing transmission amplification events, and preventing further international spread from China. Identify, isolate, and care for patients early, including providing optimized care for infected patients. Identify and reduce transmission from the animal source. Address crucial unknowns regarding clinical severity, extent of transmission and infection, treatment options, and accelerate the development of diagnostics, therapeutics, and vaccines. Communicate critical risk and event information to all communities, and counter misinformation. Minimize social and economic impact through multi-sectoral partnerships. The three types of drugs are under clinical trials. First one is repurposed drugs. This means studying the drugs that are already approved and treating similar disease for treatment of COVID-19. Chloroquine and hydroxychloroquine is a drug for treatment of malaria, and scientists are studying its effects on patients. Second is the antibody-based treatments. This could be important for helping the hardest hit and those key workers that need to stay healthy. New York is set to start testing plasma from recovered patients in a trial with the seriously ill. But most drug makers are looking at refining the process to create a concentrated and purified product, or creating artificial antibodies, often developed in mice. Their products will have to go through clinical trials, likely to take months. Third is vaccines. Vaccines are made by taking viruses or bacteria and weakening them so that they can't reproduce themselves very well or so that they can't replicate at all. Injecting the vaccine develops immunity in the body but not enough to make them sick or kill. Human trials will begin imminently. But it will take months to reach the globe. Testing, testing, testing. The novel coronavirus has revealed the critical importance of swift and accurate testing and reporting. The slowing its spread hinges on finding those who test positive for the virus and ensuring they're quarantined immediately. This requires a coordinated effort to identify all who could have come into contact with infected individuals, and testing as many of them possible, as quickly as possible. Widespread testing enables the detection of virus carriers without symptoms who could infect others. And only testing can uncover the full scope of the problem. The actual number of people infected with coronavirus, and able to spread it to others, may be 5 to 10 times greater than the number of confirmed cases. As per researchers, the data shows the number can be 40% less if the social distancing is strictly implemented one day prior. Hence most the countries are locking down even though it can seriously hit the economy of the countries. The data show, the death rates increases with the age. The death rate normally is less than 1% in age below 60, 2.5% in age group of 60 to 70 and approximately 10% in age group above 80. Many experts says the pandemic may last 18 months or longer. The world will see shortages of products. The countries will hugely spend on health care. Pollutions will come down, economic recession will kick in. There will be critical shortages of diagnostics, medical supplies. More unemployment will be seen by the world. The world economies will take time to recover.